This is another video blog. This time is Pediatric ICU, PICU. This is actually my last ICU rotation during my second year as a PGY2 emergency medicine resident. It's a month. We do 24 hours every fourth day, and we work other days as well, obviously. I have a total of 6 days off in a month. And in case you were wondering, this is Goku's hair. Down, fix her temperature. Alright, made it to the hospital. Here in the resident room, and I'm going to get my supplies. Here's my supplies. I have just an eye shield. I have my surgical hat. I have my scissors, been using for years, and just so you know, I do have links in the description for these things that I actually do use, and they're actually cheap. I don't buy expensive stuff, and I don't recommend things that don't work. That's like 10, 12 bucks. And what else do I have here? My N95, and then I have my stethoscope. 6 years old, as you can see. Look how messed up it is. MDF, but I still use it. It's amazing, and it's actually like, I want to say $25 to $30 or less. I think this is like $22 right now, and that's in the description as well. If you like it, you can check it out. It's cheap. You don't need the fancy cardiology, Littman, 4, 7, whatever. All right, adios. Pediatric ICU. Hello there. Thank you for making it this far. Before we continue with the video, I just want to say thank you for watching. Thank you for clicking. I'm Dr. Gonzalez, an emergency physician, about to be a third-year resident, but we rotate through the different ICUs. So this is one of the many videos that I have. If you're new, subscribe to the channel, like the video, and that's about it. I'm sure you can find something you like on my channel. Thank you. Now let's keep going with this video. I am escaping to get some breakfast right before we start in like a lecture on a presentation on pediatric complaints. And we did round earlier. We rounded on approximately 2 patients, and we will continue with the other patients in the pediatric ICU. Just so you know, none of them are COVID, so this is good. So let me show you this nice view. All right, so it's now almost 12 noon. I just finished reading for like an entire hour, going over one patient case which I have to present soon, and going through all the notes, all the consultant information, reading online, etc. So very interesting. Hello everyone, it is 10:35 p.m. Has been a lot more busy than expected, but it's really good. It's very interesting. And again, you're taking care of very sick kids, require a lot of work, and you have their parents. So again, they're kids, so yeah, it's a whole different game. You have to treat them like gold, which we do. So it's night out. I'm here till 7:30 a.m. the next day. So I'm showing you guys one of the rooms. We are very thankful, obviously not all facilities look like this. This is, first world. It's ridiculous. I can assure you that I worked in places that compare nothing to this. As I waited for my next pediatric emergency to happen, I noticed something interesting.
Let's talk about it.
How you guys doing? So it's approximately 12 at night, but I found this, as you saw on my video, and I wanted to just explain it quickly, since we do have patients that present with this. It's a rare condition, but it does happen. So in this case, this is another congenital heart condition, which is critical. That means these people require intervention or surgery as soon as they're born. Hypoplastic left heart syndrome. So hypoplastic, hypo, low, plastic, plasticity, molding. So low development of the left side. So as you can see here on the left side, the left ventricle and the left atrium are very small, very tiny. This whole thing, this is huge. This is normal size, low. So because this is low, there's no way for, and one of the few defects that you have in this condition is obviously underdevelopment of the left atrium and left ventricle. You may have messed up mitral valves, and you also have a atrial septal defect that connects the right atrium and the left atrium. Okay? So basically, this oxygenated blood cannot get to the body because it's very little how much it can pump, and you also have mixing of the deoxygenated blood through the septal defect. So thanks to these two things, the right ventricle can provide blood to the rest of the body. You have your PDA, okay, and your septum defect here. So blood that is deoxygenated is going to mix with oxygenated blood from the left atrium. It's going to go through your main pulmonary artery. It's going to go up. This is going to go to your lungs to get oxygenated. But some of the blood is actually going through the patent ductus arteriosum into the aorta and can perfuse the body. All right, everyone. I'm keeping you entertained tonight, and we're going to teach some basic life support, okay? So I have a whole setup. I have a mannequin, I have my filming stand, and I have some information up on the board. Let's get to it. So what you're gonna do, as you can see, is unresponsive, not breathing, only gasping, doesn't sound good. You're gonna tell someone, call 911, activate the emergency response. That person can also go get a defibrillator if available, and you're gonna start CPR. Simple as that. Hey, can you hear me? Looks like Donald Trump. Hey, can you hear me? Can you hear me? It's not responding, so we're gonna check for a pulse. At least 5 seconds, no more than 10. We don't feel a pulse. We're gonna check, look and listen for breathing. So no chest rise, no respiration. So we're gonna tell someone, activate the emergency response, call 911, get an AED if available, and you start chest compressions. So you grab your hands, and it will be where the chest finishes at the sternal line. The sternum, the muscle, sternum, right here, this area. So, pardon me, sir. Usually, the nipple lines, right here. You're gonna put your palm of your hand, you're gonna go, not like this. You're gonna go like this with your muscles. Like this. So it's at least 100 to 120 beats per minute. You want to go at least 2 inches deep and allow for full chest recoil. That means you go down, hear the click, and almost your hands come off. That way you allow for, when you compress, you're going to be squeezing the heart, pumping the blood to the body, and then you release your hands, and that's going to allow the filling of the heart. And again, and now they even recommending compressions only. You don't have to do the respiration parts where you do 30 compressions and then you breathe twice. Now they recommend this is more valuable. Perfusing the tissue is more valuable, okay? So compressions only, CPR. Especially now during COVID, you don't want to put in your mouth and it's not necessary. So you'll do compressions. So now let's review. Push hard and push fast. Compress at a rate of 100 to 120, a depth of at least 2 inches for adults, and allow for complete chest recoil after each compression. Minimize interruptions. Give effective breaths that make the chest rise, not necessary. Thank you, man. Hello? Yeah, okay. What patient is it? Okay. And this is an axillary temperature? Okay, perfect. I'll go see the patient. I'll be right there. So, they called me for this patient that we have that, apparently his heart rate and temperature are increasing. It could be infectious process. Patient could have fluid depletion. Maybe there's not enough fluid, so he's tachycardic. It could be post-surgical fever. It could be medication fever induced. So I have to go assess the patient. I'm gonna look at fluid status. I'm gonna see if he's in pain. It could be pain. A lot of times pain can also increase your heart rate. So I'll double check, okay? So here I am. I want to share this with you. Hopefully by the time this video is uploaded, I should have 1,000 subscribers. I just had to show you this. There's an actual laundry because, again, you're a resident. That means you reside in the hospital, you live here. So why not have laundry? Hello guys. So it's actually 4:45 a.m. I'm actually going to take a nap for 1 hour. This is the on-call room. 7:21, everyone. Look at this. Beautiful. I'm glad you were with me on this journey of pediatric ICU for 24 plus hours. All right, subscribe. Do it.